Welcome to my coverage of Chapter 16, Sexually Transmitted Infections. Timely because April is STD Awareness Month, or STI Awareness Month. Last week was STD Awareness Week, as sponsored by the CDC. What I'm going to do, I'm not going to overlap with all of the material that was presented in your textbook, which covers very specific information about a variety of sexually transmitted infections. You're perfectly capable of reading that information on your own, and as you've shown through your perusal interactions, you're asking great questions and showing great awareness of the information being presented there. So I'm going to focus on giving you some additional data and information, and then some more practical usable advice going beyond the suggestions in your text. So to start, and you're given some of this data in a slightly different form in your textbook, you can think about sexually transmitted infections in terms of their impact to a society, for instance, our society. So you can look at incidence, prevalence, and the economic cost of sexually transmitted infections globally. The CDC conducts regular surveillance research on incidence, prevalence, and cost. And their estimates range, but the estimates in 2008 are still pretty current. They've edged up slightly in terms of some categories of STIs, but have remained pretty stable. Annually, we get roughly 20 million new infections with STIs. Total infections at that 2008 marker, and again, these remain pretty stable. Decreases in some areas, increases in others, about 110 million total infections. The total medical cost of these kinds of infections is estimated, and this was an estimate based on 2010 figures, so I couldn't find updated data on this particular statistic, but some of the other related statistics tend to suggest that this number is even higher by quite a considerable jump now. So in 2010, it was estimated at $16 billion of costs. So you can kind of edge that up quite a bit in terms of the global costs at the present. And when we're thinking about these new infections every year, you have to understand that half of them are people like you, young people. So when you're looking at the various forms of STIs that the CDC tracks, and you're looking at hepatitis, HIV, syphilis, HSV2, gonorrhea, chlamydia, HPV, you see that the green bars are people who are above 25, the purple bars are people 15 to 24. So it's that young group has, about half of the infections in these particular areas, like HPV, chlamydia, gonorrhea, and HSV. Now, other newer estimates reveal that in the United States, what we're seeing overall in terms of new and existing sexually transmitted infections, and you'll notice that across these slides, some of the estimates are higher, some are lower. They're based on somewhat different data reporting mechanisms. But what I want you to pay attention to is that across these various forms of infection, the HSV2 and the HPV, as well as chlamydia, HIV, and hepatitis should concern you mightily, because those are diseases, particularly HPV, that can translate into incidences of cancer of the reproductive organs, and some other forms of cancers later in people's lives, which suggests the necessity for being vaccinated against those. Now, I'm done with the statistics lesson at this point. If you want to do more investigation on your own, if you're a public health kind of nerd, the CDC has open access since the data is paid for by your taxpayer dollars. You can access the data that CDC collects by visiting the CDC website. So you're at risk for STD infection if you can answer yes to any of the following questions. Have you had sex of any of these forms, vaginal, anal, or oral, without a condom? Have you ever had an STD in the past, including HIV? Have any of your partners ever had an STD? And newsflash, if you don't know, the answer is no, meaning your partner has been tested. The answer may be yes. Have you or any of your partners ever used injected drugs? So, IV drug use, such as heroin use, or shooting any other forms of drugs. The sharing of needles and blood-to-blood transmission is a possibility there. If you or any of your partners who have ever engaged in sort of transactional sex, where you're exchanging money or drugs for sex, that's a risk factor. And is it possible that any of your sex partners in the last 12 months has had sex with someone who isn't you? So many of these, you may answer yes to those questions, or you may answer I don't know to some of those questions. If that's the case, then you're at risk. The more yeses you give as answers to these questions, the more at risk you are for either currently having or becoming infected with an STD. Now, I want to give special attention to the human papillomavirus, the HPV. It is the most common of the STI infections, and it's also the infection that most men and women don't know they have. So the immune system for most people is going to clear the HPV virus within a couple of years. For some people, however, infections persist. There's no treatment for the virus directly. However, there are some symptomatic elements to the disease, and there are some related conditions, including genital warts and cervical and other kinds of cancers in both men and women. So sexually active men and women at some point in their lives are likely to contract HPV. It is that pervasive. So everyone, pretty much, who has sex and hasn't been vaccinated for HPV is vulnerable to this infection. Some public health professionals and cancer researchers argue that if we could reach a point where the majority of people, when they are young, before they become sexually active, have been vaccinated with the HPV vaccine, like Gardasil, that certain forms of cancer could be reduced to negligible levels. So, for example, I read a piece, if I can find it again, I will post it for you on D2L, where some cancer researchers, specifically cervical cancer researchers, suggested that the data suggests to them that with wide-scale vaccination with HPV vaccines could eradicate cervical cancer. And that's a pretty powerful argument for your generation needing to be vaccinated. Now, if you're thinking, I've already had sex, it's too late, you need to talk to your doctor about that and get competent advice that's based on the most recent research. The CDC's STI screening recommendations are listed here on this slide. The CDC recommends that sexually active adults and adolescents should, at a baseline, have a test once for HIV. If people have additional risk factors, they should be tested more often. Women under 25 or under, it's recommended they have an annual chlamydia screening. And older women beyond 25 who have additional risk factors, such as multiple sexual partners, it's recommended that they be tested as well. women who are at risk, so meaning they have some risk factors, maybe they have new partners or they have multiple partners, it's recommended they get a yearly gonorrhea screening. For syphilis, HIV, chlamydia, and hepatitis B, if you are pregnant, you will be screened. That's assuming you have a healthcare provider and you're doing typical prenatal care. Now, not everyone has access to that kind of prenatal care. In my pregnancies, those were screenings that were done just as a matter of course early in my pregnancy, just as a preventive measure. For many women, they don't have that kind of healthcare access, so they may not have those recommendations made to them or offered to them, and they may have to seek it out themselves if they know that that's something that they should do. The reason why pregnant women are screened for these things is that all of those conditions, all of those STIs can be transmitted to the baby either during pregnancy or during birth, which is the more likely is during birth. This one I can never pronounce properly. Trichomoniasis, I think that's close, is suggested for as an annual screen for women who have HIV infections. Screening it once a year for sexually active gay men should be done for syphilis, chlamydia, gonorrhea, and HIV. As well as bisexual men and other men who have sex with men. Now, there are complex reasons for these recommendations. Part of this has to do with general transmission rates and infection rates in those populations. So sexually active gay men who have sex with men, bisexual men who are currently having sex with men, and other men who have sex with men. Part of this has to do with the possibility of anal intercourse, which has its own risk factors if preventive measures such as condom use is not reliably used, but there are also other variables involved. Men who have sex with men, and when that sex involves multiple anonymous partners, it's also suggested that they be screened more frequently. If those are individuals also who use illicit drugs, and some of the CDC findings have made connections with not just IV drug use, but also methamphetamine use. Those are individuals who it's recommended they be screened more frequently. Now, before I leave this slide, I want to make an argument that we underscreen sexually active men in virtually all of these areas. It's very common for men, even when they have an STI, not to know it. It's somewhat more likely that women will know that they have an STI, although asymptomatic infections are very common for women too. Women, at least in US culture, are more likely to have a relationship with a gynecologist or an obstetrician who will likely recommend yearly exams. And that raises at least the possibility for discussing regular screenings for various kinds of STDs. By the time women reach their mid to late 20s, it's likely they're going to be having regular pap smears, and in some cases, some practices, that includes a regular STI screen. Men don't have that kind of regular relationship typically with a physician who's going to ask important questions about their sexual history and their likelihood of sexually transmitted infections. So one thing that the CDC and other organizations have been working toward is kind of normalizing the regular screening for STI infections among their male patients. Now I want to shift the conversation a bit from what we have been talking about so far, which is the rates of infection, the types of infections that people can get, and what kind of screening procedures are recommended by the CDC. I wanted to shift the conversation to where does where do STIs and STI prevention, where does that fit with your overall sexual health? So I want you to spend some time thinking about how, our sexual education system tends to focus on very narrow topics like don't get pregnant and don't get an STD, but doesn't really talk about sexual health and what that can mean for you and how do you get it, and so on. So I wanted to spend some time talking about that because that's not something really touched on in your textbook. I found some links, and I posted the link to this information more fully on your D2L page. But here are some of the highlights. These are called action steps to good sexual health. And they identify these 5 key areas where you can ask yourself some questions and really set out some goals for yourself to ensure that you have high quality, good sexual health throughout your lifespan. And the first recommendation is really about how you see yourself and what's right for you. Frequently we kind of find ourselves thrown into our sexual interactions and our relationships without really giving a lot of thought in advance as to what we want and what we need. And part of what you need and part of what you should want is healthy sexual encounters, and that includes STI prevention. So part of this means you need to value who you are, and you not being exposed to risks that could hurt you and make you sick is an important value to have. And you need to be able to decide what's right for you without feeling ashamed, without feeling guilty, without feeling like you're letting other people down. And that leads to the second bullet point. Be smart about your body. It's your body. You need to protect it. You need to care for it. You need to make sure that it stays healthy. And your sexuality is a part of that. So whether you're talking about avoiding domestic violence or avoiding sexual violence and making good sexual decisions in those ways, you need to make good sexual decisions about STIs and pregnancy prevention. You should, in addition to valuing yourself and getting smart about your body, you need to treat your partner well and not try to convince your partner that having sex without protection just once won't hurt you. Treat your partner with the respect that you expect for yourself. Don't have sex with multiple partners if your partner is not okay with that. And if you're going to have sex with more than one partner, make sure that there's an open conversation. So if you're in a polyamorous relationship, make sure that all the parties involved are on the same page in terms of STI prevention and testing. That requires that you build very positive relationships, which involve open and transparent communication, and the ability to express your needs and draw lines where those lines need to be drawn. If someone is treating you with disrespect, if someone is pressuring you to have sex without protection, if you don't feel safe in terms of the STI status of a potential partner, it's important that you feel confident enough to walk away from that sexual encounter. You should also start to get in the habit. I know you're only in your 20s, your early 20s, you're young, you're healthy. You need to start now thinking about your sexual health and making it a regular part of your conversation with your healthcare provider. For many of you, you are still seeing perhaps a healthcare provider from your childhood. As you move further into your adulthood, find your own healthcare provider, someone with whom you can establish a relationship over time. Far too often we have started to go with temporary care, going to a stat care. For you, your students, you often end up at the health center or waiting until a break when you can go home and see a healthcare provider. And even then, you might go to a stat care or an urgent care center where you don't see the same provider year after year who knows you and with whom you can feel comfortable. I can't emphasize enough the importance of having a relationship with a healthcare provider and being able to incorporate your sexual health as a part of your conversations about your general health with that healthcare provider. So what types of healthcare providers are are the kinds of providers who you can have that kind of relationship with? Well, first, and with you being in your early 20s, you may not have considered this. You may still be seeing a family doctor from your childhood. I know some students who still have a connection to their pediatrician from their childhood. Well, as you move out of your college experience and into your adult life beyond studenthood, give some serious consideration to finding a primary care physician, a generalist. It can be a family practice doctor, an internist, a general medicine doctor, nurse practitioners, physician assistants, and so on. These are people with whom you can establish a relationship. They are trained in medicine broadly so that they can address your whole healthcare needs, including your sexual health. Family practice doctors, for example, can do a lot of the basic testing, such as annual OBGYN checkups, including STI screening and pap smears and screening for cancer and things like that. They can also do the general every year checkups in terms of testicular health, STI screenings, and so on for men. There are specialists, and many women of reproductive age will establish a relationship fairly early on, even before they're considering pregnancy, with an OBGYN for yearly screenings. And this might be especially the case if you are getting birth control prescriptions, or if you have particular problems in terms of menstruation or hormone regulation. For men, it may be a bit later in their lives when they establish a relationship with a urologist, perhaps when they encounter an erectile dysfunction, or even on average later in life when there are prostate issues that arise. And that's unfortunate that it tends to be somewhat later in life. So again, I'm going to emphasize it's a great idea to establish a relationship with a family practice provider or a general internist, a general medicine doctor, to have those conversations with fairly early. There are also health educators who can provide information. They're not going to provide medical services or testing, but they can be very, very helpful in terms of filling in the gaps of your knowledge as you are, continuing to grow and change across your young adulthood. This may surprise you, but if you are taking medications of various kinds, it came up in class a couple of times. If you're a woman and you're taking hormonal birth control, there are certain antibiotics that if you take them, it reduces their efficacy. Pharmacists tend to be the ones who know that more quickly than even your family practice doctor might. So pharmacists are great to ask questions about medications and how those medications might affect your sexual health. So for example, let's say that you're prescribed an SSRI antidepressant for depression and anxiety. You may want to ask your pharmacist questions. Is this medication associated with sexual side effects? And what do you know about those effects? And pharmacists are educated in that in some ways more thoroughly than other kinds of medical professionals. And then finally, mental health professionals, therapists, counselors, psychologists, social workers, etc. When you're thinking about your sexual health as a component of your overall health, if you are facing mental health challenges, adjustment challenges, if you are going through counseling, there may be sexual elements to that experience, or you may be experiencing direct challenges to your sexual health, such as sexual disorders or paraphilic disorders. And those need to be, or they can be managed with healthcare professionals. But also, proactively speaking, there are ways in which you can work with a therapist to help improve your functioning, even when your functioning is pretty good. Some marriage and family counselors, for instance, offer workshops and trainings to help people enhance their relationships So not really troubleshooting or dealing with a crisis in one's relationship, but also trying to help people to deepen their relationships and improve their sexual experience. So if you're thinking about talking to your healthcare provider about the topic of STI prevention, or even just in general your sexual health, how do you go about bringing that up? We can often feel embarrassed about it, have difficulty discussing it. So it's not unusual for you to feel like you might be uncomfortable or embarrassed. In some cases, your healthcare professional might feel that way too, so they might not bring it up. It really is incumbent on you to not count on your healthcare professional to bring up these topics. They should respond to you professionally. If for whatever reason they don't and they're not comfortable, then it's probably time to find another healthcare professional. So while your discomfort is expected, try to work through that and talk openly and honestly with your provider about your body. If you have concerns about sex or sexual performance or birth control or STI possibilities, then it's important to put that on the table and talk with your doctor about the whole body kind of health ramifications of what you're experiencing. Think about how many times you've said in perusal, I did not know that was a thing. I think I should go back through all of the comments on perusal and count how many times someone has said that. You have gaps in your knowledge. Many of you have noted your sex education was incomplete and woefully deficient, and you can't believe in some of the things that you didn't know as you're reading your textbook. And let me tell you, it's a skimmed down textbook, so there's a whole lot that's not in that textbook that you still don't know. So tell yourself and believe it, you have a right to full and accurate information about your sexual health and about the sexual health of your partner. And your healthcare professional should be trained and prepared to have those conversations with you. So remember, it's your provider's job to take care of all of you, and all of you includes your sexual health. Now, here's some concrete ways to start the conversation. You can talk about how you were learning some things about STIs. You can ask your doctor point blank, how do I protect myself? Or you can say, can I get a checkup? Can we talk about my sexual health? I have some questions. I'm in a new relationship. How do I protect myself from getting pregnant or from STIs? So those are all kinds of questions that you should ask. And here are some more. You can ask direct questions about screening and testing. Now, sometimes people think, if I go in and say, I want to be tested for STIs, they're going to think that I am some kind of pervert, that I run around having sex with strangers, that I'm shooting IV drugs, that I'm doing this, that I'm doing that. Try to put that aside. You have a right to screening and testing, and it's a no-fault kind of relationship. If your doctor gets judgmental and accusatory and asks, why would you want to have screening? Are you doing something you shouldn't be doing? That's another red flag that you need a new doctor to work with. You have a right to screening and testing. You can ask specifically, what tests are you going to give me? How are they going to be done? And when and how will I get my results? That's important because some practices have different protocols. Sometimes no news is good news. If you don't get a call, everything's clear. Other times you get a call and then you have to call back, and then maybe you'll get it in the mail. It really depends on the individual practice. So it's important to ask those questions. If you don't want certain people to know that you are being tested and you don't want them to know your results, let's say you are a 20-something, but you're still on your parents' insurance. Under HIPAA rules, you have a right to say, the results of this test are confidential to me. I do not want my parents to know the results of these tests. Now, they should be doing that anyway, but it's important that you make sure that you protect your confidentiality if that's important to you. Or let's say you're a spouse and you suspect that your partner may have behaved in a way that puts you at risk. Maybe they had sex with someone else, maybe they're a drug user, and you're worried. But you don't want your partner to know. Maybe your partner's been violent in the past, but you want to get tested. You have the right to tell your healthcare provider, I want you to communicate with me in this way, either by a cell phone or by having them call someone else or mail the results to another location. And it's incumbent upon them to respond to that positively. Now, you can ask questions like, based on my history, my risk factors, should I be tested? What tests should be done? And that's an important conversation, because you should sit down and say, here are my behaviors. What are my risks? And what should I be tested for? Remember that slide, how I showed you the CDC recommendations for screening on a regular basis? Woven in there were risk factors. So you should be able to sit down with your healthcare provider and kind of think through what are your risk factors. Some family practice people who emphasize sexual health actually will have you fill out a questionnaire to evaluate your risk. You can ask your provider, how often should I be tested? You can ask if your partner should be tested. You should ask about vaccines. So I mentioned earlier the HPV vaccine, the Gardasil. Even as a 20-something, if you haven't been vaccinated yet, you should have a conversation with your healthcare provider as soon as you can to see what the recommendations are for your age group. And you can talk about prevention and protection. Now, what things might your healthcare provider ask you? One of the things that stands in the way of people having a really productive, positive relationship with their healthcare provider on the issue of sexual health is they're like, okay, if I start the conversation, what are they going to ask me? Are they going to ask me for super private things? Are they going to ask me what? What are they going to ask me? And that not knowing can inhibit people from engaging in the conversation that they need to have. You should expect your healthcare provider to ask you things like, are you having sex? If no, have you ever had sex before? They need to know that so that they can start to sort of profile your level of risk. And for the same reason, they're going to ask, what kind of people do you have sex with? Men only, women only, both? They may ask you if they are very attuned to sexual health risk factors. They're going to ask about the particular forms of sex that you have. Now, for many people, that really kind of pushes them into an uncomfortable place. It's private. It's a part of your life that you like to keep close, and you may feel like there's some shame or weirdness associated with having certain kinds of sex, like anal sex or oral sex. Excuse me. They may ask you about multiple partners within the last 6 months, within the last 12 months. And again, it's all a part of trying to determine what's your level of risk. Without asking these questions and asking them carefully, your provider can't really know what screenings are required for you. You don't need to be screened for everything just because. It's important that your healthcare provider be able to accurately decide and work with you to decide how to screen you properly. Your healthcare provider should ask you what measures you're taking for protection. Are you using condoms? Are you taking other protective measures? Are you clear about what your partner or partners are doing in terms of their protective habits? They're going to ask you about your testing history. Have you ever been tested for HIV? Would you like to be tested? And so on. They're going to ask if you've ever tested positive for STDs or STIs. Have you ever tested positive for HIV? They're going to ask you about treatment history for you and your partner. They're also going to ask you about your intentions in terms of pregnancy. because certain STIs can be passed on to the baby either during pregnancy or during childbirth, and it's important to treat those while there's still time. If you're concerned about getting pregnant or getting your partner pregnant, that's a question your healthcare provider is going to inquire about as well. Again, it's all about making mindful choices about what to screen for, how often, and what to treat for. They're going to ask about contraceptive use and the particular kinds of contraceptives being used. They're also asked some more global questions about your sexual health. I do remember the first time my family practice doctor asked me, how's sex going? And I remember, I'm not a big blusher, but that was a day I was a big blusher. I thought, wow, you went there. You totally went there. We kind of laughed about it. But then we had a really interesting conversation because I'd had a couple of kids. I was pushing 40. It was time to have that conversation. It was probably overdue. And she asked me this point blank, what questions do you have about sex now that you're pushing 40? And it really was an extraordinarily helpful conversation to have. Healthcare providers more and more often now are being encouraged to screen for sexual assault experiences and to ask mindful questions of their patients about their history of sexual coercion, especially if it's ongoing. So one of the red flags in domestic violence relationships is having a partner who coerces you to have sex, pressures you to have sex, especially if you're being pressured to have sex without protective measures, such as condom use or reciprocal testing. So doctors are being encouraged to kind of build these questions into their regular work. For instance, in some emergency departments, people will be asked on an intake form in some hospitals, is someone hurting you at home? They won't say it exactly that way, but they'll be asked questions to try and indicate whether the person who's coming in for care is a victim of domestic violence. You should also expect to be asked about your use of drugs and alcohol. And again, your doctor is not going to turn you over to the cops. That's not why they're asking. They want to know because these are risk factors for STI infection and a variety of other health consequences. They may in fact encourage you to reduce your level of use or to stop doing certain drugs because they're dangerous to your health. But it's important for you to be open and candid with your healthcare provider about those behaviors. Now, what are some of the characteristics you should look for if you are looking for a provider to work with you concerning your sexual health? First, when you walk into any healthcare provider, whether it's for sexual health or not, having a friendly and open staff who welcome you for who you are is extraordinarily important. And this is particularly notable for people who are in the LGBTQIA community. So having that open environment with a welcoming staff. When the professionals, from the receptionist up to the physician who sees you, do they talk to you with clarity? Do they use language that you can understand? And that includes, if English is not your first language, do they provide you with someone who can clearly communicate to you? Is it a provider who makes you feel comfortable? Do they listen to your concerns without belittling you, without talking down to you or telling you that you don't understand your own body? Do they answer your questions respectfully and helpfully? So far, if you have no's in any of these boxes, it's best if you walk away and find another provider. Sometimes that's not easy, but if you're being treated with disrespect, if you're not getting the answers that you need, you have a right to pursue other care providers. Do your healthcare providers ask your explicit permission before they perform tests. Now, this is supposed to be standard. If you have a care provider who just does tests and doesn't tell you about them and then charges your insurance for them, that's inappropriate. It's probably some form of fraud. I don't know for sure, but they should ask your permission before they do tests of any kind. They need to explain the choices that they're making in a way that you can understand and that you support. You have to be able to know that everything you talk about is confidential. That's a rule in medicine. I know I commented, there was someone on Perusal that talked about a friend whose STI test results were sent to her parents. That's a HIPAA violation. That's a violation of confidentiality practices. So if you can't count on your conversations being kept confidential, that's a time when you get up off the table, you get out of there because they're not behaving ethically or appropriately. You need a provider who supports your autonomy, your ability to make decisions for yourself based on your own beliefs and values. For healthcare providers, part of their training is they have to take their religious beliefs, some of their other kinds of beliefs, and kind of put them aside, because they have to respect the fact that their clients, their patients are different, and they have different lifestyles and different patterns of behavior, different experiences. Their job is to take care of your health. So some take-home messages for you before we leave this chapter. Straight from the STI Awareness Month, bunch of images. Get tested, reduce your risky behaviors, get vaccinated against HIV. Now, where can you find a testing location? There's a website on the CDC webpage, and I've included the link in D2L so you can go to it directly. At the Get Tested website sponsored by CDC, you enter your zip code and you can find free confidential testing locations near where you live. Lots of times this is testing that's provided by the health department in your location, or several other kind of pop-up clinics. I think someone on Perusal mentioned a location in, was it Cleveland? I think it was Cleveland. So take advantage of that resource. It's very helpful. To conclude, and this is another infographic that you probably can't read on the screen here, but I found it on the CDC website as part of their education campaign for STD Awareness Month. You know, there are some basic things that you can do to improve the likelihood that you will remain STI free. You can, if it works in your life, you can practice abstinence. You can use condoms. You can reduce your number of partners. You can get vaccinated. You can open the communication door with your partner about STD vulnerabilities, and you can get tested. Now, I know from our conversations, practicing abstinence may not be something that's on the table for you. It may not be something you're interested in, but it needs to be one of the options that's available to be discussed. I know for some of you in your educational history, you kind of had the abstinence-only approach kind of shoved at you without a lot of alternatives. So think about what the alternatives are. Taking control of your knowledge, learning about STI risk factors, learn about the variety of STIs that you can become vulnerable to and what behaviors make you more vulnerable. Talk with your healthcare provider, talk with your parents about getting vaccinated for HPV, and get tested on a regular basis. If you've never been tested before and you're sexually active, it is beyond time to get tested, at least at baseline. So that concludes my coverage of this chapter on sexually transmitted infections.